Band keratopathy, also known as BK, should we investigate? Now, you've probably seen this condition many times, and you may have found that the patient has perfectly normal vision, no symptoms, and seems to be well. Now, band keratopathy is a degenerative eye condition where you essentially get calcium deposition across the cornea. And where the eye is most exposed to the environment, that's where you get the deposition. And these deposits create a hazy horizontal band that can affect vision if it progresses. Now, it often starts silently, but as it develops, patients may notice glare, foreign body sensation, or a gradual decline in vision. And we're seeing on examination here at the temporal edges a grey-white chalky band, and it's got those clear spaces within it, and so that's sometimes described as a Swiss cheese pattern, and that runs horizontally across the cornea, and you can see that in this video. And so the causes really fall into two main groups: local and systemic. And so local, meaning the ocular causes, include chronic uveitis, so especially in children, long-standing glaucoma or repeated intraocular surgeries can be a cause. But if no obvious disease is present, or if you've got a patient with bilateral band keratopathy, or a younger patient, you might need to consider investigating systemically. And that's because more rarely, band keratopathy can be due to an underlying systemic disease. So I'm thinking causes of high calcium, so hyperparathyroidism, chronic kidney disease, sarcoidosis, vitamin D abnormalities. So you can do serum calcium, phosphate, parathyroid hormone, renal function, and you can even do an ACE level. So the ACE level also may have an association with uveitis. So in terms of treatment, quickly moving on, and you can just see it right there, that Swiss cheese pattern. Treatment will be that superficial keratectomy with EDTA chelation, and that removes the calcium, but think about managing the underlying cause if you suspect a patient of having this. I hope you found this video useful, and have that in the back of your mind when you see such a patient. This patient had recurrent uveitis bilaterally.